Hello class, today's lecture is on plyometrics. Our objectives are to identify the mechanical and neurological components of the neuromuscular principles involved with plyometrics, demonstrate an understanding of the phases of plyometrics, list the considerations of plyometric training, list the precautions and contraindication for plyometric training, display an understanding of the application of plyometrics to a rehabilitation program. Plyometrics is a combination of two words, plyo meaning more and metric meaning measure or measurement. This term was coined in '75 by an Olympic coach, and it was usually called jump training at the beginning and is later called or tagged plyometrics. So this uses quick movement of an eccentric activity which is followed by a burst of concentric activity which then produces a more powerful muscular output. The production of maximum strength output as quickly as possible is the goal, as the goal is for maximum power production. This is a brief explosive exercise. So the neuromuscular principles of plyometrics, first the mechanical components. We have the contractile components, which are the muscles, the myofibrils, which contain the sarcomeres, which are the contractile element of the muscle. So remember the diagram of a muscle, it's basically a cord inside of a cord, inside of a group of cords, and so it's the myofibrils that are the basic element of those cords, and it's the combination of those cords that make up the muscle unit. And then we have non-contractile components. So we have a SEC and PEC. That's not the Southeast Conference. That's a series elastic component, which is our tendon, a sheath, and a sarcolemma. And then we have the PEC, or the parallel elastic component, which is the connective tissue of the muscle. So the series, your tendon is in series with the muscle, whereas the connective tissue surrounding the muscle is in parallel to the muscle. So when a muscle concentrically contracts, the contractile components are responsible for the movement. But when a muscle eccentrically contracts, not only is the contractile components, but the SEC and the PEC are responsible for controlling the motion. Now the neurological components. So our proprioceptors are involved in plyometrics, in particular the muscle spindle and the GTO. Sudden changes in the length of the muscle during an eccentric movement, it produces a stretch reflex. And then the GTO plays an inhibitory role as the muscle shortens, which may actually store energy that is then released during the plyometric activity. So the plyometric production. Increased output of power during a concentric activity is due to one, a transfer of elastic energy that is stored in the non-contractile elements during the eccentric activity. And then secondly, an improved synchronization of the muscle activity. So the muscles are firing more in conjunction with one another. They're synchronized. So you get more recruitment of the muscle fibers than if you're just doing a squat. And then thirdly, an increased range of motion results from greater lengthening, which can produce greater forces. So we think of our length tension curve here. So as our muscle lengthens a bit more, it's able to generate more force. And then lastly, it's improved neuromuscular coordination resulting in increased efficiency of movement. We have three phases of the plyometrics. Our first phase is the eccentric phase. It's also commonly known as the stretching or cocking phase. It's the most important phase of plyometrics. During this phase, the muscle spindle is facilitated by a quick stretch. The rapid stretch produces more tension in a non-contractile components. So the PEC and the SEC are more involved in this eccentric phase. Greater response is produced by greater stimulation. So the greater the eccentric drop, then the greater concentric activity you're going to get out of the exercise. So the rate of stretch is more important than the amount of stretch. So if you're doing a box hop and you jump off a box and then you're going to jump back immediately onto the box, you don't have to drop your butt to the floor. So you don't have to drop it like it's hot. It's just you got to drop it quick and then back up quick. So the range of motion is less important than the rate of stretch, how quickly you stretch it. And then the best results are performed when it's quickly through a partial range of motion. So again, we don't have to go to the floor with these activities, but it's that quickness, that explosion back out of it. The amortization phase is the amount of time to change from the eccentric to the concentric phase. It's the transition period. So it's that hitting the ground from the time you hit the ground till the time you explode off the ground. It's the time that you catch the ball, stop the ball, and then go the other direction with the ball. That's the amortization phase. And it should be quick. When it's prolonged, then the elastic energy is going to be dissipated and might be lost, so you don't get as much out of it. So if you see somebody doing a ball plyometric activity and they catch the ball and then they bring it back and then they stop and then they throw it, that's really losing exactly what we're trying to get out of this plyometric activity. So if the prolonged amortization will inhibit the stretch reflex, so we're trying to get that quick stretch reflex to occur at the muscle, so then you gain a more forceful contraction out of it. So the quicker this phase, the more forceful the movement will be. You'll also, I think that this phase plays more into the agility and the athleticism of the individual doing the sport. So an individual that's more agile, that's able to quickly change direction, I think that they're going to get more out of the plyometric activity, or be able to get a greater result out of it. And then the last phase of plyometrics is the concentric phase, also maybe named the shortening, unloading, or the propulsion phase. So the outcome phase of the combined effects of the eccentric and the amortization phase results in greater force output. So like I said, if you're just doing a squat, then you're not going to get as much force created because it's slow and controlled. You stop, you come back up. You're getting the eccentric and the concentric activity out of the muscle, but you're not getting as much force production. So instead, if you were to squat down and then jump, you're going to get a greater force output than if you're just squatting down slow and then back up slow. So if all phases are performed properly, the result should be an increased performance, higher, further, and faster. So you should be able to jump higher, you should be able to jump farther, and you should be able to run faster or create a faster movement. So we always test with the vertical jump by having the athlete stand and just squat down and jump. But if we really wanted to see how high this athlete could jump, we would give him a step to allow him to get a greater eccentric load into the jump and a quicker amortization phase. Then you just see them kind of squat down and then jump up as high as they can. So that's the reason that somebody standing flat-footed is not going to be able to jump up and dunk a basketball, but you give them a run and start and they can probably pretty easily dunk a basketball if they're able to jump that high. So whenever we think of plyometrics, we're thinking of a rubber band. The greater the stretch on the rubber band, the greater quantity of potential elastic energy is stored, and the farther that rubber band's going to fly. So that stored elastic energy is then converted into the kinetic energy, and the rubber band flies across the room. If you barely pull it back, then it's just barely going to get past your finger. But if you really pull it back and you load it quick and then let go of it quick, then it's going to fly across the room. So plyometrics work because the elastic energy that is produced during the eccentric activity is then transferred into the concentric activity. So some prerequisites for plyometric activity: we want to have a strength base, a baseline of strength to be able to perform these, because we will lose stability when we land if we have poor strength out of this, or we'll have poor trunk control if we're trying to do upper extremity with the plyo balls and that type of thing. So you need to at least know that the person is well enough, if they're in the rehabilitation process, that they can, and they have enough strength and stability to be able to perform these plyometric activities. So one way that we can assess the stability is through static standing, single leg stance. You can do a single leg quarter squat, single leg half squat. So have them hold that for 30 seconds. If they're able to do it well with their eyes open, see how well they do it with their eyes closed. Make sure that their proprioceptive training to this point has allowed them to be able to perform these activities. So then if they're able to do the static stability test, then we can test them dynamically. So the single leg hop that we did in lab a few weeks ago, you can test side to side and then compare the 3 jumps and then divide them, and if they have an 85% or higher, then we know that they're pretty well able to perform the dynamic plyometric activities that we're asking them to do. For the upper extremity, you can do a medicine ball chest pass while in sitting. So males should be able to throw a 4-kilogram ball at least 17 feet, whereas a female should be able to throw a 2-kilogram ball 15 feet. And then we can control different variables in our plyometric program. So we can control the intensity, we can control the volume, and then on the next page, the recovery time. So our intensity is the amount of effort exerted. So we can go from a less intense by having them do double leg jumping, or we can make it more intense by having them perform single leg jumping. We can progress from simple to complex. We can add an external weight like a weighted vest. We can raise a box height. We can increase the weight of the ball that we're using if we're using the upper extremity plyoback throwing. The volume is the amount of work performed during one session. So you can measure this through the total number of foot contacts in one session. So at the beginning, you want to start off with about 70 to 100 foot contacts. And then as you advance, you want to get up to where you're doing 200 to 250 foot contacts. And then frequency. So we don't want to do these necessarily every day at a high intensity with a high volume. So we probably only want to do these about twice a week because you need 48 to 72 hours of rest for full recovery. Now I will throw in here, I don't necessarily do plyometrics as that's the only treatment that we do every day. I usually just throw some plyometric activities in with the exercises that we're doing. So as we get more intensity into the exercise program, then I'll add in some plyometrics. I might only do one set or one exercise in a treatment session. So I may do 2 or 3 sets of some light box jumping at the very beginning, and then advance those up as the athlete progresses more towards a return to play thing. So rarely do I do just a single, this is all we're going to do today is plyometric activities. I usually just work it into my treatments. And then lastly, the variable that we can control is recovery. So that's a rest time between the exercises. So longer recovery should be used because of the plyometric nature of the anaerobic nature of the plyometrics. I'm sorry. So if we're working just on power training, we want to have a 1 to 3 rest ratio or a 1 to 4. So if we're working for 15 seconds, then we would want a 45-second or 1 minute rest period in between. But if we're doing endurance training, then we want to lower that ratio down to 1 to 1 or 1 to 2. So if we're doing 30 seconds, maybe we give them a minute of rest or 30 seconds of rest. And then we want to consider training age. So in younger athletes, we want to make sure that we keep our demands fairly low. We don't want to overload them because in their youth sports, they're getting a lot of plyometric movements. You think about playing basketball, how many times you jump and land from playing basketball, how many times you run and stop, run and jump, those type of things. You're getting a lot of this activity in your sports involvement in a young age. So research has shown that plyometric training in the youth does result in strength gains. It also helps the bone mineral content in females, which is important later on in life for them. Some precautions of doing plyometric training. So a shorter period of activity is usually used. We usually use this earlier in a session. So like I said, sometimes I just work it into the exercise activity. I don't necessarily just do it at one set time, specifically at the beginning, specifically at the end. I just kind of wherever it seems to fit into what we're doing that way. You might produce delayed onset muscle soreness, especially if you do a lot of plyometric training in one day. And then some contraindications. So if we have somebody that's in an acute inflammatory process, so maybe they're just a day or so out of injury, we definitely don't want to do any plyometric activity with them because we can inflame them further. We always want to make sure that post-operatively that they've worked well through their rehabilitation and that it's not contraindicated by the surgery they had, and make sure it fits into the surgeon's protocol. And then we want to make sure that we're using this with an athlete that has good stability. So we don't want somebody that has an MCL sprain that's still pretty loosey-goosey, and we don't want to throw them out there doing single leg box hops if that knee is going to be unstable for them, because if they're not getting that medial stability from the MCL, their knee could give way, and now all of a sudden we're looking at an ACL on our hands. Likewise, if we have an upper extremity athlete who maybe is a chronic dislocator, has an unstable shoulder, we want to be real careful with doing any type of ball throws and that type of thing with them, especially if we're putting them in an open pack position, like in a 90-90 position with their shoulder. Some guidelines to follow with plyometrics. So we want a sound technical foundation. So the key element on this is execution of proper technique is in the eccentric or the landing phase, making sure that we're controlling our body, making sure the knees aren't collapsing together or falling out, making sure that we're able to control the position of our body. So the activities that we do should be specific to the goals of the athlete. So if we have an athlete that doesn't do a lot of jumping, there's not a whole lot of reason that we overload and do a bunch of jumping drills. So somebody that is a thrower, it's probably a good idea that we have good strength through our trunk and through the shoulders and out through the arm. So we'd probably want to focus more on doing plyometric activities there rather than just doing some box jumps and that type of thing. So quality over quantity. So you want to make sure that the quality of work that we're getting is much more important than just the quantity. And if you watch any CrossFit videos, that's one big thing that if you watch a lot of those, it seems like the quality tends to kind of fall apart as they're doing the exercise, yet they keep going, they keep forcing. So that's one of the big criticisms of CrossFit, is that it just doesn't focus enough on the quality of what they're doing. It focuses more on the quantity. How many reps can you do in a certain amount of time and that type of thing, rather than how many correct reps can you do during a certain amount of time. So the greater the intensity level, then the greater the recovery time. So like we talked about before, if you're just going for power, you want more recovery time. If you're going more for endurance, you want less recovery time. And these activities should be progressive in nature. So you're not going to start off with one leg box hops with a 24-inch step. You're going to start off where the athlete is. Can they do a 2-leg box hop with a 12-inch step? And then as they get better, then we're going to progress them from 2 legs to 1 leg, just like we do with any of our other exercises. So once the proper technique is no longer demonstrated, then our maximum volume has been achieved, and we stop the exercise at that point. Some plyometric categories. So plyometrics can be categorized according to loads applied to the healing tissue. So we can have medial or lateral loading, we can have a rotational load, we can have shock absorption and deceleration load. So maybe you're just doing working on shock absorption, so you want to make sure that they learn how to create a nice soft landing. So maybe you'll have them do it just a box drop. So you'll have them drop off a 12-inch box maybe and have them land nice and softly. So you can have some rotational component in it, so we work in the transverse plane. We can have some side-to-side motion as well as forward and backwards loading, just depending on how you want to apply the load, depending on their injury. You can also further categorize it into some different in-place activities, dynamic distance, depth jumping. So you can do just jumping, quick jumping, just straight up, maybe touching in the same spot on the wall repetitively. You can do dynamic distance, so how far are you able to jump out and still control it. And then you can do some depth jumping, just trying to, how high can you go? How high can you jump? Or jumping off of a box onto the ground and then jumping up onto a higher box from there. And again, you can work from simple to more complex by going from bilateral to unilateral. And that looks like our lecture for today. Hope you enjoyed it. See you in class.